But as I was saying, first of all, let's take a look at what is happening with the COVID-19 numbers this morning. And just as we were enjoying coming out of the COVID-19 woods tombs, we seem to be taking a turn here in Gauteng.
Absolutely. The very latest, of course, of those numbers looking quite huge in terms of infection numbers, revealing a significant increase in new cases. Close to 1,300 people tested positive for COVID-19 in the last 24 hours alone.
Yeah, now over 1,000 of those are just in Gauteng province. The province's health chief director, Meisie Lerutla, is going to be joining us in a moment. I believe you're going to be speaking to Meisie as well, to find out just what we are getting wrong in Gauteng.
Absolutely. Let me go straight to that conversation, having Meisie Lerutla joining us right now. Thank you for your time, Ms. Lerutla, and good morning to you. I mean, what would you attribute to this number of infections, particularly in Gauteng?
Good morning. The challenge that we are having now is in Gauteng, as you correctly articulated, we're having a very rapid increase of COVID cases in a situation where we have just moved in a period of 2 weeks from reporting under 100 new cases in a day, finding ourselves in the situation you just articulated where we have over 1,000 cases reported in 1 day. What we think is attributing to this is the fact that people are not adhering to non-pharmaceutical interventions. The control of this COVID pandemic is 90% or 100% within our control as people by ensuring that we adhere to safety measures, having our masks on, properly fitted all the time, covering the nose and the mouth, and of course, keeping proper social distancing, and of course, just ensuring that we don't find ourselves in crowded spaces and where we need to be in the company of other people. It's important that we practice those safety measures that we're talking about. And of course, the issue of the basic washing of hands and sanitizing. If we do all those things, we will definitely find ourselves controlling the spread of this pandemic. It's us as people that are moving the virus from one area to the other. So the plea is to our community. This is serious. Gauteng will soon find itself in a surge if we don't control the spread in our individual spaces. So we are really pleading, Gauteng community, please do what you have to do. Let us delay the resurgence of the fourth pandemic.
Right. Meisie, with that being said, and while you're making this appeal to Gauteng residents, what are the contingency plans in the meantime by the Gauteng department? There are talks and fears and concerns around a possible lockdown. Is that a possibility? Especially should these numbers continue to increase? Because we know that Gauteng is almost the hub where everyone, or almost most people, come to work or come to have some activities and move on to other provinces. So to assist in these numbers not spreading to other provinces from Gauteng, what's the contingency plan here from the Gauteng Health Department?
Well, as you are aware, those are executive decisions in terms of whether there are lockdowns or restrictions or whatever. However, as Gauteng, we are very ready in terms of responding to the surge. As we're seeing our numbers coming through, we have adequate plans in place, starting from the screening, the testing, just to indicate that in the past few days, we've been putting our efforts in Tshwane, which is where we have more than 65% of the cases in Gauteng coming from. So a lot of effort has been put in that district to ensure that we go into our higher learning institutions and doing screening and testing of the learners there to just try and control this pandemic. And also in terms of admissions, those that will be sick and requiring to be admitted, we have necessary plans in place. And even those who are not sick, that are positive and required to be isolated, and the contacts that may be requiring quarantine, we have all that space available. As Gauteng, we are ready for it. However, we are pleading. We do not really need to be using all the capacity that we have people let us control the spread.
Right. With that being said, there were reports of a cluster breakout, from the University of Pretoria, as well as some students, having this cluster breakout, obviously affecting them. What do you know about this and your data, just in terms of how to also manage some of these cluster breakouts within the province?
Yes, it's true. We did have a few cases at Tshwane University of Technology, also at the University of Pretoria. And just to indicate that all that has been taken care of, we have ensured that those that are positive are properly isolated to ensure that we do not encourage the spread. And also just to indicate that we've also had a few cases of matric learners that have also tested positive. And of course, as Gauteng, to ensure that they continue to write their exams because they are not really sick, we are providing a safe space for them to write their exams alone without being in the company of the other learners that are not infected. So we are seeing a few of those cases, but we are really highly in charge of the situation at this stage.
Right. Before I let you go, Ms. Lerutla, where is the Gauteng Health Department when it comes to vaccinations within the province? Are you reaching your target? Are you satisfied? Could more be done, for more Gauteng residents to get vaccinated?
With regard to vaccination, as Gauteng, we have all the plans in place to ensure that everyone that requires to be vaccinated, and we are aware that we have now even embarked on including the 12 to 17-year-olds. So we have all the plans, we have the necessary resources. What we need is the Gauteng community to present itself in our facilities for these vaccinations.
Right.
And I think you are aware that we're also making our vaccination stations even open, some of them, over the weekend, just to accommodate the people that may be working and not able to be vaccinated during the week.
All right, we have to leave it there due to time, but I appreciate your time this morning. Meisie Lerutla from the Gauteng Health Department. Thank you for your time.